हिल इन इंडिया इस दशक का बहुत बड़ा ब्रांड बन सकता है। आयुर्वेद, यूनानी, सिद्धा आदि विद्याओं पर आधारित वेलनेस सेंटर्स बहुत प्रचलित हो सकते हैं।
Historically, the term pharmaceutical industry connotes that sector of the drug industry in India which supports the practice of the allopathic system of medicine. The indigenous systems of Ayurveda, Siddha and Ijnani in existence for centuries continue to flourish, being accepted by the people and recognized by the government. At the turn of the century, in 1901, Acharya P.C. Ray with great foresight and pioneering spirit started the first Indian-owned drug factory, the Bengal Chemical and Pharmaceutical Works on the outskirts of Calcutta.
When the British left, despite the fact that we became independent, the prices of medicines did not go down. That's what the expectation was, and they were going up. The Indian industry was not flourishing at all, the generic industry, owned by Indians.
Pharmaceutical industry, when India got independence, it was completely under the control of multinational corporations or the so-called transnational corporations. There is a famous 1957 report by the US Senate noting that the world's highest medicine price was in India.
So there was a big inquiry by very renowned people, judges, and ultimately we changed the law. The new Patent Act of 1970 came into being.
Abolition of product brought the competition. For each major product, there were 30 to 100 brands competing with each other.
Indian generic industry flourished and became the dominant industry in India and started exporting. From 1988 we became net exporters of medicines, and now from 98 onwards it is the leading generic industry in the world.
The Industrial Policy Resolution of 1956 grouped the pharmaceutical industry in the category where both state and private industry could operate. The Indian Penicillin Committee, set up in 1951 at the Alafkine Institute, marked the beginning of government entry into the industry, and a public sector enterprise, Islandustan Antibiotics, was established in 1954. Indian pharmaceutical companies were ascending the value chain with a focus on innovation. By June 2010, the country's top 20 leading pharmaceutical companies and their subsidiaries had received US FDA approval for 72 ANDAs. Both the industry and the GOI have enhanced the level of investments in R&D capabilities and infrastructure. Dr. Reddy's Laboratories' new chemical entity Balaglitazone is India's first indigenously developed molecule to enter the Phase 3 trial. The growing R&D pipeline of Indian companies presents significant in-licensing opportunities for global companies. In March 2018, Pradhan Mantri Jan Arogya Yojana, PMJAY, was launched as an ambitious reform to the Indian health system that seeks to provide financial health protection for 500 million of the most vulnerable Indians and halt the slide of the 50 to 60 million Indians who fall into poverty annually as a result of medical-related expenditure. As a result, poor patients of the country can easily get access to certain medical procedures which were not affordable in the past. The pharmaceutical industry of India witnessed the darkest arc of its time during the unprecedented COVID-19 pandemic, which hit the country in 2020 when the pharmacy retail market was valued at 1,783.83 billion Indian rupees and is expected to reach 3,078.46 billion Indian rupees by 2026, expanding at a CAGR of 12.02%. The organized retail pharmacy sector stood at 134.21 billion Indian rupees in the same year and is anticipated to reach 370.39 billion Indian rupees by 2026. This industry is taking notes from its shortcomings and is now evolving to cater to the needs of the market and to achieve the aims with which the industry was established. Today, India is the largest provider of generic drugs globally. Indian pharmaceutical sector supplies over 50% of global demand for various vaccines, 40% of generic demand in the US and 25% of all medicine in the UK. Globally, India ranks third in terms of pharmaceutical production by volume and 14th by value.
I think we are going to see become one of the pharma kings of the world.